The Gulf Coast Growth Show is sponsored by Chevron Pasadena Refinery and is an extension of the Economic Alliance Houston Port Region, where our mission is to market and grow a vibrant regional economy. Hey guys, welcome back to the Gulf Coast Growth Show. I'm your host, Jason Lee, joined by my co-host, Zeke Smith.
What's up, Jason?
And we are trying some new stuff out today. So we've got our first attempt in studio to go live with the guy who is in his studio a few miles away in Canada, Mr. Ryan Todd from Headversity. Ryan, how you doing today?
I'm doing well. Thanks for having me, guys.
Well, we're excited to have you. This is a passion project for Zeke. It's something that he's just committed to when it comes to the headspace and mental awareness and really just trying to tee things up, especially in the construction industrial industry. We've talked about it several times. I have had multiple guests on talking about the critical importance of really just focusing in on their employees and keeping them right when it comes to giving them the support they need to battle mental issues and bring awareness to the industry. And so we're glad to have you on to share something about that. I'm going to pivot, throw it to my man here because I know you guys have a great relationship and have some experience. Before we dive in, give us a little bit of a background on who you guys are, what you do, just kind of an overlay of where, Headversity and Ryan Todd's story.
Yeah, the two are connected. So I'll maybe start with myself. So I'm a psychiatrist. I work here at a large hospital in Calgary, Alberta, which is a quite industrial part of the world. And I train. It absolutely is the sister city of Houston. And so you train for about a decade to become a psychiatrist, then you start your practice. And within a couple of days of starting my practice, I had a massive wait list of patients. And that was shocking to me because you don't really get exposed to the system when you're training as much. You know about the problems, but they really slap you in the face when you start your clinical practice. A lot of my patients were from industrial parts of the workforce because of where we're situated in Alberta. And I used some of that frustration to start a company that focused on prevention. So essentially what a psychiatrist would do is bring someone into their clinic, diagnose them, and then set them up with a treatment plan. A lot of that treatment plan is around skills. What can you do day to day? What are some little practices that you can do? What are things you can learn more about to help you with your own mental health? It's very unique in that way in terms of a medical practice, that the individual is really responsible for carrying out some of these practices. And we built that into a technology, essentially a learning system that can help individuals that want to upskill their mental health or resilience. We have built that into a team setting where safety leaders or HR leaders, anyone who leads a team really, can run their team through a 3 or 5 minute training session on mental health. And then we've recently launched something called CERT, which is more mandatory training around things like mental health, respect in the workplace, psychological safety in the workplace. And so, yeah, that's Headversity. And we work with a ton of groups in your area and a ton in the industrial space. And we're excited to keep the message going because the need is, I think, the most acute in construction, and the statistics would bear that out. And so we have a lot of work to do.
Yeah, Ryan and his group are working with, obviously, Apache. Satterfield-Pontique is another member of the Alliance. PCL, large customer out of Canada, but also a big presence here. And then I believe they work with Shell. Is that right, Ryan?
Yeah, that's right. Yep.
Wow. So few large members of the Alliance, so we're glad to have you here. Ryan, so we've obviously talked before, buddy, but give us your kind of overview, state of the union for the construction and manufacturing space and what you're seeing. Has it gotten better from a mental health standpoint? Is it getting worse? Is it a flat trend? What are you guys seeing on the ground there for our industries that we kind of support?
Yeah, we're seeing a couple things. Like there's two opposing forces. One, the outcomes are not getting better. We still see in most jurisdictions, but the best data is out of the province of Ontario and a couple of states where they track this data closely. We're still seeing shocking numbers. Like for every 3 overdose deaths, one of those is a construction worker from an opioid. We're still seeing massive increases in, so I shouldn't say increases, but suicide rates in the construction industry are 5 times the national average. So we're really trying to fight that. What we're seeing, the opposing force we're seeing, is there's more groups doing things about the issue. There's more groups coming together, suicide alliances. Zeke, you're doing a ton of work, and you're getting a really good sense of what is being done across the country. We're one of the few groups that works and goes really deep in construction and industrial because it's a technology company at its core that sometimes doesn't work with groups that have a large frontline workforce. And so a lot of the companies in our vertical will go to banks and government, people who are working in front of a computer. We don't shy away from working with large industrial companies. So we're trying to do more. I'm seeing more research on it. So I'm really hoping that catches up with the epidemic that we're seeing, or the crisis that we're really seeing in mental health. The thing about any mental health crisis, though, is it's really unseen. You don't hear about it in the news. We don't talk about it enough. So having these conversations is something that I believe with deep conviction is something that we need to do more of.
Yeah, for sure. And so you mentioned a training platform. So your mission all along, really, but I think it's starting to catch fire a little bit. 2 years ago, it was all about awareness. Hey, by the way, look at this. Look at the statistics here. Jason, I've shared this with you before that suicides in construction outnumber the other focus 4 incidents, leading incidents of death in construction for OSHA. So that was alarming. The deaths, I think in 2022 in construction, there was like 1,000 deaths and there was 5,000 suicides in construction. So it was 5 times. I think construction's second only to mining in suicide deaths. So there's obviously something going on. And Ryan just alluded to the opioid deal. So second in industry for excessive alcohol use, 20% more opioid prescriptions in construction and manufacturing. And the prescriptions that we're receiving in this industry are 20% stronger. So that's a pretty dangerous cocktail, right? You've got, our region is full of hardworking folks,
right?
Who don't, they work long hours, very dangerous environments with quite literally things that will catch fire and blow up, right? And then having to deal with all of those things on top of it, right? So lack of elective surgeries during the pandemic and all the things, right? So just a really dangerous cocktail. What I think is remarkable about what the kind of next step in this thing is, and I want Ryan to address this, is I think most people understand now, or at least, those in this industry understand this is a problem. But a lot of folks are still wondering, okay, what can we do about it? Can we just send them home to get well and they come back when they're better? And so what the next step, in my opinion, I certainly think Ryan will agree, is, okay, we train these folks on these plant sites at, Chevron, Pasadena Refinery. They know what to do in every single crisis that could ever happen on that plant site, right? Mm-hmm. So that every alarm, bell, whistle, anything goes off, they know where to go, what to do, who to grab, who to contact. So why wouldn't the same companies train those folks, at least to some extent, to deal with their own personal crisis? And I think that's where Ryan and his group is kind of stepping in. And that's the way we're using the platform at Apache for our frontline workers is, hey, we're training you in all this safety, but we're also going to include the mental health and resiliency as a part of your safety training, that total human health initiative. So Ryan, if you add some color to that, where you're seeing successes and why you think the training aspect of it is so much more effective than just talking about the awareness and making it this downstream issue.
Yeah, I think the closer that we attach this issue to a safety issue, which it is, if we're looking at the worst outcome of any incident on site or even at home is a death, the closer we align those two things, the more power we're going to have in this industry to really make change. If we keep it in the like nice to have educational space, then it will always be a nice to have. And I don't think there's any excuse anymore for industry leaders to say, well, what do we do? We know what to do, right? We provide some of that upfront education. We provide the resources and support for people who need ongoing care. And we also have really low barrier access to crisis resources. Those are the 3 things that you need. And there's a lot of groups, not just Headversity, that can help you and consult and roll these platforms out to help. So that narrative is changing. I think in 5 years, we're having a very different conversation about how to get to the next level. Right now, a lot of companies are struggling with putting in some of those foundational pieces. Foundational education is one, around mental health and how to have a mental health conversation and what to do if you're unwell. Two, having those ongoing individual supports for people who want to train these types of skills. And then three, you need that crisis. You need that crisis line. So I think that message is getting out. It's starting to shift. I would say in my experience, like I worked in Fort McMurray, call it 20 years ago. This is not a group of industries that focuses on speed of change. There's a conservatism that's been beneficial for the industry in a lot of ways because of the process and the learned history of everything. And some of those standards of practice need to change. And I think they will, and we can keep pushing them. But the statistics around them are so expensive and so alarming that I think it's only a matter of time before this becomes standard of practice for most companies.
Yeah, and look, there's a tie, and I know you've seen this and know about it, Ryan, and maybe Jason, you can comment too. But there's a tie into mentally healthy, resilient employees and productivity. There's a bunch of data out there, and I know you guys are pushing that out as well. Like, this isn't just a warm and fuzzy topic to, take care of employees and have more engaged. There's actual data to say, hey, someone who's mentally healthy, resilient, not stressed, not distracted, is more safe and more productive, right? And I know you guys are speaking about that message all over the place, right, Ryan?
Yeah, where we're at, like during the Industrial Revolution, that's where coffee breaks were invented. They found out that people who were weaving materials could work for 12 hours in a row, and we could get X amount of productivity out of those individuals, or we could give them 2 or 3 coffee breaks throughout the day and get them recharged, get them fed, hydrated, and they saw productivity climb. So there's a dramatic shift with a simple change in a standard of practice. And we're in that space right now where when it comes to mental health and when it comes to helping take care of that individual. And it's so intuitive. It just makes sense that somebody who is distracted because they are thinking about something at home, or they're maybe not as present because they are on a low dose of, fentanyl or an opioid, or they are not as sharp as they should be in the morning because they had a 6-pack of beer the night before. These are things that are so intuitive. I think the intimidation part from leaders has come from, what do we do? Like, what do we do about these things? Because we know so much of our workforce may show up to work hungover, might be using opioids for pain relief, might be dealing with a crisis at home. Like, what do we actually do about that? And there was a generation where we just kind of said, we're not going to do really anything about it. We're going to accept that as part of the culture. We'll accept the increase in safety risks, and we'll accept that and just build that into our models. That's changing. And we're at that kind of coffee break change in the way that the industry is thinking about this. And I can tell because we're having more conversations about it.
Well, one of the things that I know, is I just think about the amount of pressure that this industry can place on individuals. When you think about, I just think I've got clients that are in the industry, and we just had a week's worth of work, right? Of rain. in Houston. 6 days in a row, and 6 days in a row meant one of my clients is a concrete contractor, so that's 6 days of
no work.
We're not working. Right. So what does that mean? That means about 14 days straight of catch up because you've got some deadline and other, so there's just. There's way larger systemic issues around how things have operated in this industry for hundreds of years, right? It's just the nature of the beast. I think you combine that nature of the beast with a rare type of individual who has the capacity to do that type of work, right? Not too many people can even. These guys are wearing that, but it's almost like a badge of honor too, right? Their hands are all beat up. They're just that's kind of who these guys are.
Right.
So then how do you take a kind of a systemic fundamental gap inside of the industry that's just the way that it almost kind of has to operate? Then you center that around some guys that are I'm not really the kind of guy that's going to raise my hand and ask for help because that's not even who I am. So how do you, it sounds to me, it's a noble cause, right? And getting the awareness out there, and companies can do that. But then how do you penetrate down into the people to get them to kind of maybe shift their thought process and speak up? Like, because you can put all the cool stuff in place, but if the guys are still wired a certain way, what's the secret to cracking that code inside their heads to get them to say, yeah, I'm going to raise my hand and ask for some help, to even know that they have a problem?
I think it's a great question. And I think the piece about toughness is very useful for individuals. Like, that's adaptive behavior because they work in very physically tough environments, and they're demanded upon to be rocks for their family and providers for their family. And that is structured throughout the whole business in construction and industry. So, like, one thing I don't want is for us to ever sit here, and we're not saying this, but for us to sit here and say that's a bad thing. That resilience, that toughness, we got to beat that out of the culture. That is the opposite of what we got to do. I think we have to get stories from leaders. And we know that just from demographic data that folks who work in this industry, their top two interests, family and sport. We have to include more athletes who have had experiences with mental health. And this is starting to come out as well. And really consider, I did a talk about this a couple months back in New York with a large drilling group. And the point of what I was trying to say was, we should consider our frontline workers as athletes. And we hear a lot of justs in this industry, like, I'm just a millwright, I'm just a laborer, right? I'm just a drywaller. I think that's BS. And I think we have to really consider these folks as athletes and promote that, which gives them permission to take care of their bodies and their minds. That's the angle that I think we really need to attack this with.
I like that. I think, we talked about it. Just starting the conversation is a very powerful jumping off point for this, because when companies start to say this, we're not just going to talk about it for Mental Health May, this is what we do here. Mm-hmm. I've used this analogy before for all of our churchgoers here. Like, you got the pastor up front, you got the vestry member, the council of elders that always talk, but you got that one influential congregation member in the back that stands up and says, hey, this is how we should do it here. That's a powerful voice. Right. It's not somebody with a title that has necessarily has been given respect or power. They've gained it through their presence, their charitable contributions, whatever. Right. You define those folks in the workforce. The guys that are foremen, just been there for 20, 30 years, never really wanted a fancy title, but they have a lot of influence, and get those folks talking. And I have found, this has been my direct experience through Apache, is once you start talking about it, these folks just kind of pop up. They're like, oh, we talk about that here? It's like, yeah, well, I was dealing with this and my son. And you start to see these things bubble up. Mm-hmm. And then it's like, oh, so we talk about this. That's great. And that will trickle through. And you start to cut through some of that, whether it's machismo or macho or tough, or I don't need any help, or, sometimes we tend to talk clinically and that blows right by them. So you talk in their language and you'd be shocked of how quickly this spreads in a good way. Right. Ryan, you asked me this question before, I think it was last October, so I'll ask it back to you as we get to the home stretch here. Do we feel like we're getting overkill? Like, are people tiring of this talk yet? Like, I had a conversation with somebody that said, oh yeah, this is all BS, because people just say they're always overwhelmed. They need a mental health day, or they need a break. So are we at that point where it's like, we've been talking about it? I mean, you and I have been talking for 3 years, right? Since pandemic time. Mm-hmm. Are we there yet in any industry that you're seeing where it's like it's overkill and we're starting to resist and go backwards a bit, or are we still trending in the right direction?
I think that in this industry, there's always the risk of it being seen as getting kind of lumped in with a woke movement, and we have seen across the last 2 years, anything in this industry that's labeled woke there's big time pushback on it. So I don't think we can lump it in with other types of social movements. I think that's a bad idea if we want to really, get into the minds and hearts of folks and give them permission to take care of themselves. So I think that's one thing. I also agree with the clinical piece. if we keep talking about depression and anxiety and have you considered this? Like, if you have eggheads like me talk about this all day long, yeah, you're gonna be tone deaf to it because it's not engaging. What I believe is that we have to hear more stories from people, as you mentioned in the back row, Zeke, and from leaders in the community. Those tend to be athletes and also executives. And when those people put their hand up and can chat about it, and we can connect this to taking care of yourself so you can get home at night, taking care of yourself so you can provide for your family, those are still powerful messages. And that has almost nothing to do with this mental health thing that can sometimes be lumped in with more of a social movement. And to kind of just tie that in, the question is, are we swinging too far? Are we over engaging with the mental health narrative? There's some demographics that I think that's true with. I would say, for example, our young people right now are potentially over engaging with talking about things like anxiety and ADHD, right? And we're seeing the repercussions of that in the public healthcare system. And we have to manage that, right? Stigma has been so far reduced, which is a great thing.
Sure.
Maybe too many people are engaging with that narrative. I don't think we're there in construction, like not even damn close. So I think we have a ways to go.
Yeah.
I laugh because I think about my daughter coming home and self-diagnosing herself all the time with just because oh my God, my world was so tough. I must have be full of anxiety and stress and whatever. TikTok says I need more whatever anti-anxiety or ADHD. It must be the ADHD I have, Dad. You're like, dear God. Breaks.
Yeah, no doubt.
Yeah, no, I can see how it could take a slippery slope if you're not very cognizant of your messaging and then how you do it. And then especially, like you said, who delivers it, right? It's got to be the right people out there championing it.
The tie into safety is it. I mean, that's what it is.
Yeah.
Period in a story. Safety is paramount in our industry.
And it's not a foreign language. No, right? It's like it's like a core belief.
Right? You throw the safety statistics about mental health and suicide in our industry, and those safety folks, they perk right up, and I've seen it directly. So, Ryan, as we hit the final minutes here, any big news on your end other than it becoming springtime in Canada, which is always the big news for you guys? I'm sure it's like 43 degrees over there right now.
There's only two seasons, winter and summer. That's it.
Right. So what's other than hockey playoffs? What's going on with you guys up there? Anything good?
That's interesting. We're doing a lot of work with the National Hockey League, which is really exciting. They've taken topics around respect in the workplace and mental health for their players and all their employees very seriously across the league. So we're really excited to engage that league with that work. And we're growing our reach across North America through both sport and a lot of workplaces. So we're busy. And this work continues to keep our team rolling.
Well, two things about the NHL. If you got any influence, maybe help get us a team down here in Houston. We're anxious for that. And the second thing is, I love the respect in the workplace piece, but let's not get rid of the fighting. That's like part of the charm of hockey. So don't influence them too much, right? Just core. That's a core business model for the NHL. Is
that's part of the respect. That's part of the respect model, maintaining that.
That's right. Yeah, that's right. That's right. I love it. Yeah. I love it, man. Well, thank you so much, brother, for taking time with us. And we appreciate you as always and appreciate the partnership. And I know all the folks that work with you guys are loving it and really reaping the benefits. So if anybody wants to get a hold of you guys, I know you're too busy to talk to the regular folks these days, but anybody at your shop, how do people get a hold of you guys up there?
That's not true, Zeke. So just look me up on LinkedIn, Ryan Todd.
Dr. Ryan Todd.
I don't know if it is on LinkedIn. I just say Ryan Todd, look me up on LinkedIn, shoot me a direct message and we'll get in touch. Super easy to get a hold of me. My email's on there. I'm an open book. So Ryan Todd on LinkedIn is the best way to connect.
And the website?
Headversity.com.
There you go. All right, guys. Well, hey, Ryan, it was a pleasure having you join us today. You're on a mission and it's fantastic. It's a noble one at that. And so thankful to have you My friend here, my partner in crime, has a sincere passion and speaks very highly of the work that you guys are doing in this space, because it means something to him, which means it means something to all of us down here in Houston. So it's critical, and we appreciate the work that you're doing. So, and for our audience, as always, we want to thank you for tuning in to the Gulf Coast Growth Show. We try to bring great value content and talk about the highlights and the wonderful things that are happening in this region and the impact that we're trying to have in the industries that support the region with guys like Ryan and all of our other partners out here. So we'd ask that you just tune in, stay plugged into myself and Zeke. If you want to get a hold of us, the best place to do that is through LinkedIn. You can message us directly, keep us poised and up to speed on anybody that you want us to bring on the show. We'd love to hear from you. So thanks and have a great week. Thanks for tuning in. And be sure to go to the Economic Alliance Houston Port Region website and subscribe to our channels. Let's pay it forward by sharing the good news of what's happening in our region by passing this episode to somebody you know.